Uro-458 is used to relieve discomfort, pain, frequent urge to urinate, and cramps/spasms of the urinary tract caused by an infection or a medical procedure. It contains methenamine, an antibacterial drug, and methylene blue, an antiseptic that helps prevent the growth of bacteria in the urine. It also contains salicylate, a pain reliever, and an ingredient to make the urine more acidic, which helps methenamine work better. Hyoscyamine is also included to relax the muscles of the urinary tract to relieve cramps/spasms. It's important to note that this medication should not be used to treat a urinary tract infection, and it is not recommended for children younger than 6 years old. In order to get the most benefit from Uro-458, it is important to take it as directed by your doctor. Usually, this means taking it 4 times a day with a full glass of water. After taking the medication, make sure to wait at least 10 minutes before lying down. It's also important to drink plenty of fluids unless your doctor tells you otherwise. If you experience stomach upset, you can take Uro-458 with food. The dosage of Uro-458 is based on your medical condition, age, and how you respond to treatment. It's crucial not to increase your dose or use the drug more frequently or for longer than prescribed. Taking more than directed won't improve your condition any faster and can increase your risk of side effects. If you also take antacids, it's important to know that they can decrease the absorption and effectiveness of Uro-458. To avoid this, take Uro-458 at least 1 hour before antacids. To get the best effect, take the medication at the same times each day. It's important to be mindful of your caffeine intake while taking Uro-458, as caffeine can increase the side effects of the medication. Try to avoid consuming large amounts of caffeine-containing beverages like coffee, tea, and colas, as well as eating large amounts of chocolate or taking non-prescription products that contain caffeine. If your condition doesn't improve after a few days of taking Uro-458, or if you develop signs of a urinary tract infection such as burning, painful, or frequent urination, be sure to inform your doctor. If you experience nausea, vomiting, dry mouth, dizziness, drowsiness, blurred vision, or constipation, it's important to let your doctor or pharmacist know. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. This medication may cause your urine and sometimes stools to turn blue-green, which is harmless and will go away when you stop taking the medication. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience hot/dry/flushed skin, decreased sweating, eye pain, difficult urination, or signs of kidney problems. Seek medical help immediately if you have symptoms such as easy bruising/bleeding, black/tarry stools, stomach/abdominal pain, vomit that looks like coffee grounds, or signs of liver problems. In rare cases, this medication may cause extremely high blood pressure, which can be life-threatening. If you experience severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, sweaty/clammy skin, widened pupils, vision changes, or sudden sensitivity to light, seek medical help right away. While very serious allergic reactions to this drug are rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember, if you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Uro-458, make sure to let your doctor know if you are allergic to any of its ingredients, aspirin, NSAIDs, belladonna alkaloids, or if you have any other allergies. It's important to talk to your pharmacist for more details. Also, inform your doctor about your medical history, especially if you have kidney or liver problems, urinary blockage problems, difficulty urinating, stomach/intestinal disorders, glaucoma, heart problems, high blood pressure, myasthenia gravis, bleeding/clotting problems, certain enzyme deficiencies, aspirin-sensitive asthma, growths in the nose, stroke, severe/frequent headaches, adrenal gland tumor, or dehydration. This medication may cause dizziness, drowsiness, or blurred vision. Avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do it safely. It's important to limit alcohol, marijuana, tobacco, and alcohol use to lower the risk of stomach bleeding. Uro-458 may make you sweat less, increasing the risk of heat stroke. Avoid activities that may cause you to overheat, such as hard work or exercise in hot weather. When it's hot, make sure to drink plenty of fluids and dress lightly. If you overheat, find a place to cool down and rest. Seek medical help if you have a fever that does not go away, mental/mood changes, headache, or dizziness. Before undergoing surgery, make sure to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children and older adults may be more sensitive to the side effects of this medication, so it's important to monitor them closely for any unusual symptoms. If you are pregnant or planning to become pregnant, discuss the potential risks and benefits of using Uro-458 with your doctor. This medication may harm an unborn baby and cause problems with normal labor/delivery, and it is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor determines that you need to use this medication between 20 and 30 weeks of pregnancy, it should be at the lowest effective dose for the shortest possible time. It's important to not use this medication after 30 weeks of pregnancy. Additionally, Uro-458 passes into breast milk and may have undesirable effects on a nursing infant, so consult your doctor before breastfeeding. Remember to check the How to Use section for specific details on how to take Uro-458. Uro-458 may interact with a variety of other medications, potentially affecting how they work or increasing the risk of serious side effects. It's important to keep a list of all the products you use, such as prescription and non-prescription drugs, herbal products, and share it with your doctor and pharmacist. Do not change the dosage or stop taking any medication without your doctor's approval. This medication can interact with many different products, including certain high blood pressure drugs, Parkinson's disease drugs, and antibiotics. It may also increase the risk of bleeding when taken with other drugs that can also cause bleeding, and should not be taken with other MAO inhibitors. It's important to talk to your doctor or pharmacist about all the medications you are taking, including herbal products and over-the-counter drugs. If you are also taking azole antifungal drugs, take Uro-458 at least 2 hours after the antifungal drug. Additionally, be sure to check all prescription and non-prescription medicine labels carefully since many medications contain ingredients that may interact with Uro-458. This medication may also cause drowsiness, so be cautious when taking it with other products that may cause drowsiness, such as alcohol, antihistamines, and opioid pain relievers. It's important to speak with your doctor or pharmacist about using these products safely. Lastly, Uro-458 may interfere with certain lab tests, potentially causing false results, so it's important to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Uro-458 and has serious symptoms like passing out or trouble breathing, it's important to call for emergency help right away. U.S. residents can contact their local poison control center at 1-800-222-1222, and Canadian residents can call a provincial poison control center. Symptoms of an overdose may include fever, fast or pounding heartbeat, severe dizziness, seizures, slowed or shallow breathing, and unusual excitement. If you or someone you know has taken too much Uro-458, seek medical help immediately. Narration: it is important not to share Uro-458 with others. This medication is specifically for your use and should not be taken by anyone else. If you forget to take a dose of Uro-458, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When storing Uro-458, make sure to keep it at room temperature and away from light and moisture. It's important to keep it out of reach of children and pets. If you need to dispose of Uro-458, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of Uro-458. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.